Hello everyone. Continuing with the psychological complications in puerperium, today we will discuss about puerperal psychosis. So, postpartum psychosis is a rare psychiatric emergency in which symptoms of high mood and racing thoughts, depression, severe confusion, loss of inhibition, paranoia, hallucination and delusions sets in. It begins suddenly in the first 2 weeks after childbirth. And then in etiology or the causes, we see that it is because of the hormonal changes. Because once the placenta, that is the hormonal factory, is delivered, there is sudden shutdown in the hormones, leading to hormonal changes. And then it may be because of older mothers, and also the risk factors includes history of previous mental illness suffered by the mother, and prior episode of postpartum psychosis experienced by the mother, and family history of mental illness or postpartum psychosis, and then pregnancy and delivery complications, cesarean section or sex of the baby. For example, like an unplanned cesarean section, a mother prepared for a normal vaginal delivery suddenly undergoing a cesarean section, or a mother expecting a girl child delivering a male child. All those shifts in their psychology may lead to puerperal psychosis. And also it may be seen in women giving birth for the first time. And then in clinical manifestation, the signs and symptoms that we will see are hallucination of hearing, sight and touch. That is, hearing things or seeing things, being touched by the things which does not actually exist, and delusions may be there. These are false bizarre beliefs which are not really reality based. And then there will be extreme mood swings that will be seen. There will be restlessness and inability to fall asleep, and then a woman may do or say inappropriate things or may react out, and she may experience suicidal impulses or the desire to harm her baby. So in management, because of the extreme nature of the illness, a medical help is immediately required, and the mother must be kept under constant observation until appropriate psychiatric help is obtained, and heavy sedation is given at the time of onset, and early treatment with antipsychotic drugs under the care of psychiatric team is usually instituted. A drug may be administered, that is chlorpromazine 150 mg as that dose, and then thereon 50 to 150 mg twice a day may be given. And then a mother must admit to the psychiatric unit, and treatment must be started with lithium in case there is severe depressive psychosis, and also an ECT or electroconvulsive therapy may be given. And then antipsychotic drugs and mood stabilizing drugs such as lithium are usually administered, and also a family support is must and should be provided via the social workers. And then to prevent postpartum psychological disorders that we have discussed, we have prenatal screening. So in prenatal screening, and also we have prenatal preparation and postnatal assessment. So in prenatal screening, a psychiatric history should be routinely obtained on a new obstetric patient, and the mother should be asked about any previous treatment for psychological or emotional problems, because problems such as depression and anxiety disorders are often left untreated, and obstetricians should inquire about times when the patient might have been out of her normal mood state for more than 2 weeks at a time, and multiparous mothers should be asked specifically about postpartum adjustment after previous deliveries. And in prenatal preparation, it is very much necessary to emphasize on the pregnant woman that although mild mood swings or disturbances are common after delivery, they are usually not very severe and are short-lived. And more serious disorders such as postpartum depression and particularly postpartum psychosis are much less common. Moreover, a mother can be told that the experience of these blues is rather normal and may reflect the effect of exhaustion, relief of tension built up before and immediately after delivery, or the initial process of coping with the demands of the newborn baby. Finally, a woman should know whom to contact if she is having any emotional problems after delivery. And a mother who has had previous psychiatric disturbances should be monitored very much closely. For any woman with a history of psychosis, it is advisable to make arrangements during pregnancy for her to consult with psychiatric, and then in postnatal assessment, the obstetricians should inquire about the mother's mood before sending her home from the hospital. The healthcare workers must ensure that a mother and the baby is going healthy home. And if a patient reports of some mood disturbances, mood swings, reassurance can be provided regarding the likelihood of its being short-lived. And the obstetrician should tell the mother that if the condition lasts for long, they must report immediately. And then also, some mothers may be returning to an unhappy or an abusive relationship, or they may have some financial problems that will affect her motherhood. Therefore, the mother, before sending her home, an appropriate referral to hospitals or any social worker cares or any therapy centers and any such indicated, the mother must be sent. So this is all about postpartum psychological disorders. Then coming to nursing assessment, we have to, as a nurse, we have to assess the ability of the mother to cope up with the period following childbirth. And then psychological assessment is a must to know the mental functioning of the mother. And then the mother must be kept under constant observation to identify any abnormal behavior following childbirth. And we have to pay extra attention to the mood and behavior of the mother towards the baby as well as towards the family members, and any unusual behavior must be reported. And if any severe mood swings or any severe signs and symptoms are detected, then the healthcare worker, as a healthcare workers, we must promptly initiate treatment for faster recovery of the mother.